So our driver for the implementation of 7-day working was very much the KEO report, and we wanted to actually look at what we do. And we're very clear that patients don't get sick Monday to Friday 9 to 5, and actually there is a need to deliver the service across the whole week. I think when you see the evidence on mortality, morbidity, with weekend admissions, you as a health profession you can't but need to extend your service, and I think that was absolutely the key driver for us. And for us as a department, when the Trust set up its 7-day working party, pharmacy were seen as key facilitators in that whole process, and so from a Trust perspective we were asked to be part of that first wave because they saw us as a key facilitator.
I joined the Trust working group for 7-day services, and really just to echo what Ruth said, is every one of the clinicians around that table wanted pharmacy services there at the weekend, and that really helped our process because we got that buy-in from day one from our key clinicians.
So I think the first thing to say is when we started with our own working party within pharmacy, what was clear was that the staff recognised the need. There was no challenge from the staff as to the value of the service being there. The greatest challenge as to who was going to deliver it, because they didn't particularly want to be there, though the need for the service was accepted. So there was quite a sort of difficult balance to be struck there. I think fundamentally pharmacy as a support service has traditionally had limited resource at the weekend. We've had fixed weekends on a rota basis, working short hours. In some departments across the country that's not even been part of Agenda for Change hours, and so we'd done a piece of work previously that brought our weekends into Agenda for Change hours, but they were still a 4-hour shift once every 5 weeks, and there's a huge cultural change to move that to a full day service, and it took a lot of staff engagement to get to a position where we had a rota which we felt, one, delivered a service, and two, would be acceptable to the staff. On balance, sometimes I think one of the things I would learn from this is actually about listening to experts, because we did a lot of listening to staff, and actually there was a number of key things that came through the staff consultation about the rotas. They wanted it to be a whole team effort. They didn't want it to be isolated groups. They wanted their weekends to be full weekends, so you sort of got one hit and you had your weekend hit all in one go, and they wanted their compensatory rest days together. And actually our staff side reps on that group were very against a number of those issues. They felt that they didn't mirror other working groups sort of rosters and so forth, and actually we went through with that because it was acceptable to staff. We felt we'd have the team on board in doing that, but actually quite interestingly within the 6-month period people found the 7-day, because it's working the weekend, having 2 rest days together and working 2 full days the weekend means you work 7 days in a row, and actually staff found that pattern very difficult. And I think had we listened to our experts and not been quite so driven by the emotion, which was actually a very difficult thing to control, we might have come up with a better solution in the first place.
It is a never-ending process, so we can't just say we implemented a 7-day service and walk away from that. We implemented our full 7-day service back in December 2014, and since then we've been through a process of continuously reviewing, reshaping that service. One of the things is that other services are coming online with working 7-day services. So we know that AMU has always been 7-day service, but now we do surgery at a weekend. We have more outpatient clinics at the weekend, and we've had to respond to that in a timely manner. But also it means that we've had to bring our staff with us, and that's been difficult because we introduced a new service. It was highly emotive. We managed the cultural change. But then we keep moving, we keep changing, we keep developing, and we have to bring our staff with us.
I mean, one of the things we found was that one of the selling points for the staff in terms of implementing the service originally was that actually the clinical team would be delivering a clinical service at ward level for patients at a weekend, and that they saw as a really valuable thing to be doing. But over that period of time, we've seen a 29% increase in our dispensary workload as these other services have come online. And what has happened is that in order to deliver that dispensary workload safely and accurately, we had to bring those clinical staff back into the dispensary. So that's been something that we had to manage, because actually you'd got their agreement to do this service, and then you sort of changed the goalposts because that was the service need.
We measured our benefits, and one of the things that was really important to us is that we were out there at the weekends, and we measured that we were doing 300 clinical interventions in a month, and that was just on a Saturday and a Sunday. Before we implemented the service, we were doing nothing. We weren't out there. We were in the dispensary behind the closed door, very much concentrating on supply. And to move from 0 to 300 a month. Now, what we do know is that some of those interventions could potentially be life-saving. So our staff are really proud of that achievement and of that service.
Yeah, so I think there's definitely, and I think there's a lot of information about missed doses, and actually the fact that we're open longer means that patients get the medicines that are prescribed, and administered when they're prescribed. And in terms of patient flow, actually, if patients aren't going to leave the hospital if they're not better, they don't get better if they don't have their medicines. So actually the fact that we actually have an accurate supply of medicines available across the week in the same hours, actually I think has been a real benefit as well. And we've certainly seen patients go home more quickly. And I think if the one thing that patients say as they come into hospital is, when can I go home? And we've recently rebranded our dispensing turnaround time for discharges as the get me home time, because actually we wanted to focus the team on actually what that meant. And our get me home time has actually significantly reduced over the last couple of years, and a large part of that is to do with the fact that we now issue I think the annual level at the moment is around 65% of our discharge medicines go at the weekend as well from the wards. They don't hit the dispensary, and that reduces the get me home time from around a 3-hour turnaround by the time the transport from to and from the dispensary is included to around 30 minutes. So actually that's a huge benefit from a patient experience perspective, as well as from an operational management of the service.
We have quite a lot of specialist staff. So we have a paediatric pharmacist, we have a cardiology pharmacist. At the weekend, that paediatric pharmacist may be working on acute medicine. So it's enabled us to widen our skill sets across the team and make the team a lot more flexible. Now, some staff have found that challenging, but many staff have actually rose to that challenge and really enjoy now working in more of a generalist area at the weekend. For other staff, it's helped with things like childcare, so that they can have a day off in the week but work at the weekend, perhaps when their partner is at home. So it has had some benefits for some staff.
Probably the key thing for us, and we still haven't got this right, is staff skill mix. So actually, and part of our problem is as your staff become more senior, their work-life balance issues change. And so what's challenging for some staff groups is less challenging for others. So our junior staff are actually quite keen to have days off in the week and do stuff. And we've now changed the rota so that they work more weekends. The frequency, the way it's worked, they work more weekend days, but the rotas have worked so they hit a little less often, but they still get their days back in the week. And the juniors have taken that and flown. They think that's great. The more senior staff wanted to switch back to working one day at the weekend and having it actually hit perhaps a bit more frequently. So I think probably the key message for us would be that one size doesn't fit all in terms of your staff groups. We tried, from an equity point of view, to mirror the everybody works 1 weekend in 5, everybody had a 1 weekend in 5 rota previously, and we tried for equity to continue that. And I think the reality of the service delivery now is that actually one size doesn't fit all. You have to look at the skills that are needed to deliver the service and then actually work your rotas around that, rather than trying to just make a bigger service on the same sort of equity for all, because it doesn't work, because people have different sets.
And for me, it's look what other people are doing. Don't just look within pharmacy, look at what other health professionals are doing. Look how the nurses manage their rotas. Look what imaging or pathology are doing, because actually you can learn a lot by looking how different health professionals are working, and share that information with your staff. Don't keep that to yourself.